Hi friends, how are you? I hope everyone is good today. Today we want to discuss about the difference between primary biliary cirrhosis and also primary sclerosing cholengitis. These both diseases have similarities such as both will causes chronic cholestatic liver disease and which result in cirrhotic and also hepatic failure. So let's go to the difference between the pathological or the definitions of primary biliary cirrhosis. So it's an intrahepatic bile duct destruction. What does that mean? That means it's an autoimmune disease of the liver. It's a slow progressive destructions of small bile duct of the liver causes bile and other toxin to build up in the liver and form cholestasis. So for the primary sclerosing cholangitis, the definitions will be intra and extrahepatic bile duct thickening and lumen narrowing. So what does that mean? That means it's a long progressive disease of the liver and the gallbladder, which is characterized by inflammation and scarring of the bile duct. What does happen when there will be inflammation and the scarring of the bile duct? There will be thickening and lumen narrowing and will cause a serious liver damage. So under the demographic, so the gender will be more important for the disease to differentiate. So in primary biliary cirrhosis, female is more common for this disease compared to the male. Whereas in primary sclerosing cholangitis, male is more common than female. So next we will go to the association with inflammatory bowel disease. So under this, primary biliary cirrhosis doesn't connected to any association with inflammatory bowel disease, whereas for primary sclerosing cholangitis there is the link. There is the causes, maybe there is a relation between ulceration cholangitis and also Crohn disease. These, if you have ulcerative cholangitis also or Crohn disease, you might have primary sclerosing cholangitis. It's interlinked. So maybe in the next video we might discuss about ulcerative cholangitis. Next we will go to the symptoms. So for the primary biliary cirrhotics, we will see the symptoms are fatigue, pruritus, jaundice, right upper quadrant discomfort or pain in the upper right abdomen, and also osteoporosis, which means weak and brittle bones, which lead to the osteoporosis and also fracture later on. Portal hypertension, xanthomata. What is xanthomata? Xanthomata is a deposition of yellowish cholesterol-rich material that can appear anywhere in the body, whereas xanthomata is a fat deposit on the skin around the eyes, eyelid, on the creases of palm, soles, elbows or knees. It's more common, it's related to jaundice also. For primary sclerosing cholangitis, the symptoms are also same, which is jaundice, pruritus, fatigue, malaise, weight loss, and also we have osteoporosis here. I have to add it on, and also osteoporosis. So the symptoms will be right upper quadrant pain also included. Then the early symptom for the primary sclerosing cholangitis will be fatigue and itching, only the early symptoms. Whereas as it progresses, you can see the symptoms of right upper quadrant pain, fever, chills, night sweats, enlarged liver, enlarged spleen, weight loss, and also jaundice. So for the diagnosis for primary biliary cirrhosis, we will test for the blood test, where we will check it for anti-mitochondrial antibodies, which is called AMA. This substance almost never occurs in people without the disease, even if they have other liver disorders. So basically, if you have a liver disease, it will show positive for mitochondrial antibodies. And next will be for the liver biopsy. So for the liver biopsy, we will have a procedure of remove a small pieces of the liver tissues, then examine under the microscope for the sign of the damage or the disease. Diagnosis of primary sclerosing cholengitis, we have more testers or more diagnoses used, but most commonly we will use is ERCP. What is ERCP? Is endoscopy retrograde cholangopancreatography. It is used by doctor as a flexible tube passed down your throat to inject dye in the areas of your small intestine where your bile duct is empty. It is actually doctor will use this as a confirmation of your disease for the primary sclerosing cholangitis. So for the diagnosis of primary sclerosing cholangitis, there will be more techniques that doctors will be using, such as liver test, cholesterol test, and like antimitochondrial antibodies and liver biopsy also. But for more commonly, they will be using ERCP. What is ERCP? ERCP is endoscopy retrograde cholangopancreatography. So basically this procedure is more common in use. Why and how it is uses? So it is actually as a flexible lighted tube called an endoscope also. So endoscope or scope, it's as thick as your index finger. It goes through your mouth into your stomach and first part of your intestine called the duodenum. Then the doctor put a very small flexible plastic tube through the scope and inject some dye that show up on the x-ray. So this procedure allow your doctor to see the ducts. So how will be the duct? When the it's normal or it's a bead like dilatation in intra and extra hepatic bile duct. If there is a bead like dilatations, it is confirmation of primary sclerosing cholangitis. Okay. For the treatment for primary biliary cirrhosis, the most drug which is used is ursodeoxycholic acid, which is a slow progression drug. What is this medicine? This medicine is also known as ursodiol. Is commonly used first. Why? It helps move bile through your liver. But this medication does not cure primary biliary cirrhosis, but it seems to improve the liver function and reduce liver scarring. So it's less likely to help with itching. So in this normally these both disease is more common is also itching is the primary or the early symptoms. So it's slightly help in So this medication is used for help in itching and also fatigues. But this medication is also having some side effect which may include weight gain, hair loss and also diarrhea. The next medication is, I didn't write it here, I will write it here, which is obeticholic acid, which also called as Ocaliva, which is given alone or combined with ursodeoxycholic acid. For 12 months, it can help improve your liver functions. There is studies also about these two medications given to improve your liver functions better. And we can give also other medications such as Trexel and Colicres. And the last, if you cannot treat by giving these drugs, the last option will be liver transplant. And for the itching and also fatigues, what are the other medication we can give? We can give as antihistamine, rifampin, opioid antagonist also we can give to the patient when he has fatigues and also itchiness. It's the first stage for the primary biliary cirrhosis. And there you can also sometimes have a lifestyle and home remedies for treating primary biliary cirrhosis, which by reducing your sodium intakes and never eat oyster or other raw fish. Why? Because Oysters such as seafood can carry infection, cause bacteria, and if you have liver disease it can more damage your liver. And exercise most days of the week. By exercising you can decrease the osteoporosis. And avoid alcohol because it can more stress, and also so you have to avoid alcohol also to lessen the damage of the liver. And also check for your doctor before starting new medication or dietary supplements. It's like you have to change your lifestyle. And for the prevention of primary biliary cirrhosis, there are some tips I can give you. So by increasing pressure in portal veins, which means I told you for primary biliary cirrhosis you will have portal hypertension. So your doctor is likely to screen and monitor you for the portal hypertension and enlarged veins if you have a liver disease. So you can do that procedure with your doctor. And for the weak bones, for osteoporosis, I told you before, you can exercise to minimize osteoporosis by increase your bone density. And also you can take calcium and vitamin D supplements. And for the vitamin deficiency, such as I told you xanthomata, xanthilomata and also xanthomata, you can take vitamins such as vitamin A, D, E, K to improve your vitamin level in your body. So for the treatment for the primary sclerosing cholengitis, there is a treatment also before we go to the liver transplant. Liver transplant will be for the advanced staging. So the starting treatment will be, I told you, itching and also fatigues. We can give like antibiotics, antihistamine and also opioid antagonists, and also for bile acid sequestrants. What is bile acid sequestrants? Is a first line treatment for itching in primary sclerosing cholangitis. And also you can use ursodeoxy acid. This all medication we can use this both for this primary sclerosing cholangitis for the early stage of this disease. But if you have infections, we can give you the antibiotics. And also nutrition support. I told you earlier, you have to reduce the salt, you have to never eat the seafood and etc. And for the more important is the treatment for the bile duct. Okay, for the treatment of bile duct blockage under the primary sclerosing cholangitis. Basically, primary sclerosing cholangitis making the lumen to narrow. So, what we have to do? We can do ERCP. By doing ERCP, if you have some blockage there, we can do a balloon dilatation. What is this balloon dilatation? This procedure can be open blockage in the larger bile duct outside of the liver. In balloon dilatation, the doctor will be using the slender tube with an inflatable balloon at the tip, which also called as balloon catheter, through the endoscope and into the blocked bile duct. Once the balloon catheter is in the place, the balloon is inflated. So we can make the normal movements of the biles from the gallbladder to the liver. And the first was balloon dilatation, and second will be a stent placement. In this procedure, as a doctor uses endoscopy and attach instrument to the place a small plastic tube called stent in the blocked bile duct to hold the duct open so that it won't narrow or it never closes. So this is the placement of stent. These two is the treatment for the bile duct blockage. If all this treatment and antibiotics doesn't work under the primary sclerosing cholangitis, one have to do the liver transplant. Because during liver transplants, for these cases, basically the surgeon will remove your diseased liver and replace with the healthy liver of the donor. So it's more common for nowadays. And guys, for more about management of primary biliary cirrhosis and also primary sclerosing cholangitis, I will be posting in my Facebook page Easy Medicine, I Insta page Easy Medicines also. Just have a look over there, and also please like, share and subscribe my YouTube channels. For the end of this video, I'll be discussing about this ERCP, endoscopy retrograde cholangiopancreatopathy, how they do and etc. And also about the treatment of bile duct blockage, and so that you can more understand about the procedure and why they doing this procedure. Thank you.